Well, welcome. Oh, here we go. There's more people showing up already. Awesome. Well, welcome. Today is an awesome day in the assembly. We have with us Dr. Philip Ovadia, a cardiac surgeon. He's been a cardiac surgeon over 30 years. He's performed over 3,000 open heart surgeries, and he joins us today. And what he's going to tell you and make you question everything your doctor has told you about your heart. So, welcome, Dr. Ovadia.
Great to be here
Pleasure to
with
have
you.
you.
Yep, great to see you again.
I About a month ago, we met in person at Meat Stock, and you were hosting a lunch for your patients. And I happen to know someone who is a patient of yours, and he actually offered up his seat for me. So I was grateful and honored to be present. And I think the biggest thing that stuck out to me about you was the fact that you were sitting at a table with your patients, communing over a meal. That's just something you don't hear too much about these days. And so, if anything, it really speaks to the heart of who you are, and grateful to finally have met you in person. And here we are today talking about, well, what you've seen with being a cardiac surgeon. And I'm just grateful to have you here. So, welcome, sir.
Yeah, thank you. It was really a great experience to be able to meet you in person. And, what you didn't mention about that meal that maybe made it even more unusual than a doctor sitting down with a bunch of his patients over a meal was that I was a heart surgeon at a Brazilian steakhouse with all of my patients, eating all of the red meat that we could get our hands on.
Yes, yes, yes. Well, we're definitely going to talk more about that here in just a few minutes. But starting off, now you've performed over 3,000 open heart surgeries.
Yep.
Most surgeons in that position spend their careers refining the procedure. You walked away from that trajectory to do something entirely different. What happened?
Well, we can get into the whole backstory, but the bottom line of it was I recognized that no matter how good I got as a heart surgeon, no matter how good all of the heart surgeons out there might be, the patient on my operating table was never going to be as good as if they would have been if they didn't need the surgery in the first place, because heart surgery ultimately is a band-aid on a problem, right? We have patients who come to us and they have, primarily what we deal with is blockages in the arteries of the heart, what we call atherosclerotic heart disease. And we're there trying to basically reroute the blood, lay new pipes so that the heart again can get the blood flow that it needs. And again, it's an amazing operation. I feel blessed every time that I'm able to help someone by doing that. But it became apparent to me that it didn't matter how good I did at that operation. They still had heart disease. And if there is a way that we can prevent them from getting to the operating table, prevent them from getting that advanced stage of heart disease, that patient is going to be much better off. And, a lot of this interacts with my personal health journey, but ultimately discovering that the patients shouldn't end up on my operating table. The fact that anyone gets to that advanced stage of heart disease is a failure. And it's not the patient's failure, it's the medical system that has failed. It's the doctors that have failed because heart disease is a totally preventable disease, and we need to do a better job at preventing it so that we don't need to spend all of the time and resources that we do trying to treat and manage it.
Awesome. Wow. I can tell this is going to be an amazing conversation. So good. Well, walk us through what is actually happening in the arterial wall that produces a cardiac event. What is the upstream driver the statin model never addresses?
Yeah, and that's a great question to be asking, right? Because the traditional, what we now know is the diet heart hypothesis, right? The cholesterol centric view of heart disease that has been, the dogma, I'll say, for the past 70 years is that this cholesterol floating around in our bloodstream, which may or may not be related to cholesterol that we eat, but that you have enough cholesterol in your bloodstream, and ultimately that cholesterol is basically going to stick to the blood vessel wall and cause plaque to form, and that plaque can then end up choking off or obstructing the blood vessel, and that's what leads to heart disease. But the reality is you asked the right question. What's happening in the blood vessel wall that allows cholesterol to start to stick and build up? Because under normal circumstances, cholesterol does not attach to the blood vessel wall. It doesn't cross what we call the endothelium, the protective layer lining the blood vessels, it won't therefore make it into the blood vessel wall to get stuck. And so, if we really want to figure out what's causing heart disease, we shouldn't be looking at the cholesterol. We should be looking at the endothelium. We should be looking at what is damaging the endothelium. And now recognize that the cholesterol is actually there to try and repair this problem. It's not what caused the problem in the first place. One of my favorite analogies for this is every time there's a house on fire, right? If you go by the scene of the fire, there's going to be firemen there. And if you didn't know any different, you would think, well, these men must be starting the fires. But in fact, they're there to try and put out the fire. And that's basically what cholesterol is doing. It's trying to put out the fire. It's trying to repair the damage to the blood vessel wall that didn't occur because of the cholesterol. It occurs because of things like insulin resistance, high blood sugar, inflammation that might be coming from toxins such as smoking or other toxins in our environment that damage that blood vessel wall. So, if we want to have a meaningful impact on preventing heart disease, we need to stop the damage to the blood vessel wall first and foremost.
Yes. Yes. And you mentioned insulin resistance, and that's actually the next question. Fasting insulin, where does it sit in your cardiovascular risk framework?
Yeah, it should be at the top, right? So we have some recent data came out of the Women's Health Initiative study. Very large study, 40 or 50,000 women tracked over 30 to 40 years. And they went back and they looked at the risk factors that predicted heart disease. And what they saw was that if women in the study who had an increased LDL cholesterol level, they had a 40% increase in their risk of heart disease, right? So 1.4x increase over women that did not have an elevated LDL level. When they looked at a measure of insulin resistance, the one they used in the study was called the LPIR measurement, lipoprotein insulin resistance. Having an abnormal elevated LPIR score, your risk goes up 600%, 6x, right? So
Mm-hmm.
much larger magnitude of risk associated with the insulin resistance than with the LDL cholesterol. And fasting insulin level is an even simpler way of detecting potential insulin resistance. And so that really, in my mind, is cardiac, the top blood marker of cardiac risk. And if your doctor is talking to you about heart disease and they haven't checked an insulin level and they don't know if you're insulin resistant, and all they're looking at is your LDL cholesterol number, that doctor is not serving you well. Time to find a new doctor, or time to have the conversation with your doctor about, okay, what about my insulin resistance?
Yeah, oftentimes we know this as clinicians that insulin resistance can be present for decades before even we see changes with blood sugar. And so
Exactly.
it's something that stirs, and it's really a testimony, I believe, to just the resilience of the body. That first marker in, when insulin resistance shows up, to be able to hold the line before we start to see, more downstream impacts from just dysregulation, right? But moving on to cholesterol, ApoB, LPA, the markers the standard lipid panel doesn't capture. What are you actually looking at when you evaluate cardiovascular risk with precision?
Yeah. So when we start talking about cholesterol, I really try to reframe the discussion around it's not about how much cholesterol is in your bloodstream, it's about the quality of the cholesterol that's in your bloodstream. So your basic lipid panel, you're measuring LDL. Your doctor maybe is, thinking they're more up to date and they're checking something called ApoB. And, this is all looking at the amount of cholesterol. LDL cholesterol, ApoB takes into account something called VLDL cholesterol, but it's not recognizing that all LDL cholesterol is not the same. All LDL cholesterol particles are not the same, we should say. Broadly speaking, there are classes of LDL cholesterol particles, and we have basically what are called small, dense particles, and we have large, buoyant particles. And these actually act very differently. The small, dense particles, they are problematic. They are what we call atherogenic. And those are the particles that, get stuck in the blood vessel wall and set off this inflammatory reaction that then ultimately leads to the plaque building up. However, the large LDL particles do not. They are non-atherogenic particles. And so if you're looking at someone with LDL or an ApoB level that's considered high, and you don't know whether you're dealing with a lot of small particles or a lot of large particles, you're not getting the complete story. And even more problematic is this, because this actually applies to probably a lot more people out there. You might have what's considered to be a good, low, normal LDL or ApoB level. But if you have a lot of those large particles that's making up that LDL, you are still at high risk, and your doctor is missing it. And these patients end up on my operating table all the time. And they ask me, they say, my LDL has been good. I've been on the medications for decades. Why am I here? How did I still end up with the disease that, we were supposedly controlling and treating? And the answer is because their doctors did not get the full picture when it comes to their cholesterol, and specifically their cholesterol quality. So, when you look at the cholesterol quality, what you start to see is a whole different picture. You see some patients that their LDL is what, the mainstream systems considers to be high, but that LDL is made up of mostly large, healthy particles. And those patients are not at risk of heart disease. And then, like I said, you see the patients that their LDL is controlled, is good. Maybe they're on medications, maybe they're not, but they have a lot of those small particles, and those patients are still at high risk. And that's why you need the advanced lipid metrics, so you can tell the quality of your cholesterol, and that gives you a better picture of what your actual risk might be.
Gotcha. Beautiful. All right. Well, let's turn to. I'm getting hungry, so let's turn to meat. Grass-fed ruminant meat, saturated fat, the diet the American Heart Association has warned against for 50 years.
Yep.
What is, I already know this, but these members of the assembly and people need to hear this. What is your clinical position stated without hedging?
Without hedging, my position is meat is medicine. Meat
Yes.
is essential to human health. So not only is it not harmful like we've been told for the past 70 years, but it is actually essential and beneficial to heart health in particular, and general overall health. Meat was never the problem. We evolved. We spent millions of years as human beings evolving eating red meat. It would make no sense that somehow this was problematic or harmful to us. And, meat started to take the blame when they were trying to figure out what was causing heart disease. And that was based on poor science, in some cases, fraudulent science. And, more charitably, we can just say misinterpretation of science. But ultimately, meat, the saturated fat that's occurring in animal products, in meat, is not harmful for our heart, and it is not harmful for our health overall. And so the message that I'm here as a cardiac surgeon to spread is, like I said, meat is medicine, and we shouldn't be fearing it. And in fact, myself and a whole community around us, right? My patients and, the broader community has discovered that eating almost all meat or nothing but meat is not only not harming our health, but it's putting us in the best health that many of us have been in our entire lives.
Yes, I will testify to that for myself. Amen. Yes. Seed oils, the linoleic acid conversation. What has the research actually shown about industrial processed polyunsaturated fat and cardiovascular health? I think
Yeah, the
this is
balance
really
of the
general.
research shows that it is bad for our health. The only reason that we think it might be that it might have some benefit was because it lowers our LDL cholesterol level. And, that is not something I deny, that it will lower your LDL cholesterol level. The problem is that lowering your LDL cholesterol level isn't making you healthier, especially when you're doing it by eating seed oils, because it turns out, going back to the earlier part of the conversation, when you eat those seed oils, yes, your LDL goes down, but your quality shifts and you get more of those small, dense, harmful particles. So again, the studies have never really shown outcomes-based benefit to increasing our consumption of vegetable and seed oils. Um, Evolutionarily, again, this is not something that we were ever exposed to until the most recent blip in time, the past 100 years or so, that someone decided that it would be a good idea to take an industrial waste product and somehow start putting it in our food supply. And even though they figured out a process that it doesn't kill you instantly, it's not poisonous any longer, we now see the long-term effects of consuming this, and they are not beneficial for our health, and they're certainly not necessary by any means for human health. So this is one of the top things that I now advise people to avoid at all costs.
Yes, yes. Well, how about a testimony, a patient who made the metabolic transition? What changed in their markers, their function, their life? Just, I'm sure you've helped so many. Is there one that comes to mind that you could kind of share the trajectory of the
Yeah, we can
progress?
talk about, the 45-year-old woman, right, who was literally on death's door with heart failure. She was in the hospital. She was, her heart function had decreased dramatically. And she was basically being told that she was going to end up needing a heart transplant. They got her out of the intensive care unit after a couple of weeks. They got her, good enough to go home on a boatload of medications. And they basically told her that, she was going to need a heart transplant probably within the next 6 months. And she started focusing on her metabolic health. She changed the food that she ate. And by that 6 month mark that they told her she was going to need a heart transplant, we actually had her off all of her medication. Her heart function had returned to normal, and she was back to an even healthier life that she had before she had gotten sick, because she had reversed, metabolic disease that had been present for a long time. So,
Wow.
I have stories like that. I also have my 80 plus year olds. We have about a half dozen now in the practice that are in their 80s and 90s. And they have adopted metabolically healthy lifestyles. And they are doing amazing. And they are telling me that they feel like they're in their 50s again. And, they're getting off all sorts of medications, blood pressure medications, diabetes medications, heart related medications that they no longer need because their health has improved so significantly. So I always tell people it's never too young. It's never too, early to start doing this, but it's also never too late to start paying attention to your metabolic health.
Yes. Yes. Well, I think you kind of answered this a little bit just with that testimony, but is there a point of no return in cardiovascular disease, or have you obviously you just shared a testimony of recovery where the system said there wasn't anything possible just with that?
Yeah, I tell my patients today we can always get you better, right? We might not get
Yeah.
you to perfect. We might not be able to undo all of the damage that's been done. But the first priority I have with all of my patients is let's stop things from getting worse, right? Because that is the natural history of heart disease. You go to any heart clinic, right? Any cardiologist, you talk to the patients, right? And it's just a matter, their goal is to slow down how quickly you're getting worse, right? Their goal is not, they're not thinking about getting you better because, quite frankly, they never see that occur. The definition of success when it comes to treating heart disease is that we keep you alive longer and we basically slow the decline. And I'm here to tell people that that's not good enough. If we address the root cause, what is causing you to continue to get worse, right? Now
Mm-hmm.
we can stop the progression, and then the body can do what it's supposed to do, which is heal, and we can actually start to see improvement in these conditions.
Yes. Yeah. Well, you have a book releasing soon. I think in just a couple months, if I'm not mistaken. So
Yep.
share with us what the book is about and what drove you to write it.
Yeah, so Stay Off My Kitchen Table. It's being released July 28th. It's available for pre order now. You can go to stayoffmykitchentable.com or you can go to any of your favorite booksellers and get it there. And this is the follow up to my first book, which was Stay Off My Operating Table. And what I aim to do in the second book, the reason that I decided to write the second book is because I recognized that people still had a lot of confusion about what should stay and what should come off their kitchen tables. People were going on, what we tell them are healthy dietary strategies. And this can be something like low carb or carnivore, but they weren't getting the results that they, were hoping for from it. And I wanted to help people understand why. And one of the things that I came to understand is so important in all this is it's not just about what you eat. It's not just about the food that you put in your mouth. It's also about what your body does with that food. And so understanding concepts like bioavailability, nutrient density, and why this really informs us about what are the foods that we should be eating and shouldn't be eating. That was the deeper understanding that I was hoping to get to people with this second book. So Stay Off My Kitchen Table. It's going to be the heart surgeon's guide to metabolic health. We give you a 4-week outline, a 4-week plan that you can follow to start your journey on metabolic health. And we help you understand, again, why certain foods should stay on your kitchen table and why certain foods need to come off your kitchen table so that you then can stay off my operating table.
Oh, that's awesome. That's such a great strategy. Just um yes. Praise the Lord. So, for the person in this assembly tonight who has a spouse, a parent, a friend whose cardiologist has told them their condition is manageable but not reversible, I can think of two people in my practice at Live Free Chiropractic who said that they're seeing their cardiologist for their yearly update here in a couple weeks. What is something that you would some advice that you would give them walking into that appointment, hearing this conversation that we've had today, to keep in mind or look for with their doctor?
Yeah. So the two big things I would tell people to push their doctor on is, have you evaluated me for insulin resistance? And have you evaluated me for inflammation? These are I talk about the two kind of hidden eyes, right, that can help us see into heart disease: insulin resistance and inflammation. And then there's a third eye that that oftentimes gets missed as well. And this is the imaging, because a lot of our focus in heart disease is around all these blood metrics that we've been talking about, right? But there is no blood test that tells you how much plaque is in the arteries of my heart. That can only be done with imaging. And the great news is that today we have amazing imaging that can show us exactly how much plaque is in our heart. And then when we do that imaging, on a repeated basis, we can now see what's changing in terms of the plaque in our heart. And we can then really start to test out, okay, my doctor told me I should be on a low-fat diet and take a statin. How's that working out? Is that plaque in my arteries getting worse or not? Right? Or my doctor, right? I go see that crazy heart surgeon who told me I should be on a carnivore diet, and don't take any statins. Is that plaque in my heart getting worse or not? Right? I want to see what is actually happening with the disease that we are concerned about. I really, on some level, don't have much interest in these indirect blood measures anymore. Show me what's happening with the plaque. Now, we now know, right, when we start to match up these things, we're going to see even more clearly demonstrated, what these blood markers that supposedly have to do with heart disease really have to do with heart disease or not. And I'm pretty confident that as we do this more and more, and again, we're starting to get this data accumulating, things like insulin resistance and inflammation, these are what inform us about heart disease. The cholesterol quality is what informs us. It is not about your cholesterol level. And this is going to give us the different path as to how we are going to successfully stop the progression of heart disease and keep people from the operating table.
Yes. And yes. Last question. So you left the operating table to tell the truth. What do you most want the next 5 years to produce?
Yeah, my goal is very simple. I do not want heart disease to be the number one killer anymore. I believe that we can accomplish that. I think we can accomplish it in the next 5 years, the next 10 years, the next 20 years. But I want to know, and I haven't actually left the operating room yet. I'm still operating some. But, ultimately what I want to know is when I leave this earth, that heart disease is no longer the number one killer. That's my mission in life, and that's what we're accomplishing.
That is amazing. Well, I would say that's a hefty mission, and I'm grateful that you are carrying that and spreading the word, reaching as many people as you can, even the clinicians, right? I mean, that's greatest impact is the more clinicians that could understand what you've revealed and what you know, the greater the greater your impact just expands exponentially. So
Yeah, you and I were together at Meat Stock. Besides all of the amazing, people there, right? The
yeah,
audience members there, we also saw how many amazing clinicians were there. And,
yes,
this is something that I have seen the growth in over the past few years, that ultimately doctors are fed up as well, right? Doctors are disappointed by the results that they are seeing in their patients, and they want to do better. They want to do better for their patients. And that, I think, is what's steering them towards this discussion around metabolic disease. and what we can be doing from a diet and lifestyle perspective, instead of just, like I said, slowing the decline of our patients with a ton of pharmaceutical agents. We can have meaningful impact and help them actually reverse disease and improve their health, primarily by focusing on diet and lifestyle.
That's right. That's right. It all starts in the gut. It all starts in the gut. Amen. Awesome. Well, I just want to thank you and also give you the opportunity if there's anything that you would like to share. I know we've talked about the book. I will make sure to post that and spread that along to other people. Um, is there anything else that you would like to share today?
Yeah, anyone else that wants to follow what we're doing, iFixHearts is the place to go. You can go to ifixhearts.com. You can find me on all the social medias at iFixHearts. And again, I would greatly appreciate and be thankful for anyone that wants to go to stayoffmyoperatingtable.com, pre-order the new book, and we'll get it in your hands July 28th. And I promise it will be worth the wait.
Yes, I'm excited to receive my copy. We will make sure to spread the word. And again, Dr. Ovadia, thank you for spending time with us, and thank you for standing, um, well, for all those people that just need to hear the truth about health and metabolic health. I really appreciate it.
Thank you for all the work you're doing. I look forward to the next time we can share a steak together.
Sounds great. Well, I'll be there next year, so maybe that'll happen. Awesome, sir. Have a blessed day. We'll see you.